Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello there, my name is Katrina James, and I'm one of the area managers here at Practice Plan. Thank you very much for joining today's podcast. I'm joined today with Louise Anderson, who's the Regional Support Manager for South Wales, and of course some areas just over the borders there into England. Louise, welcome and thanks very much for joining me today.
Well, thank you for having me. It's a pleasure.
I know it's always good when we get together, Louise, because we're both based here sort of in southwest Wales, and we do tend to chew the cud quite a little bit when it comes to the issues that arise here in Wales. And we know quite often these are different to what's going on in other parts of the four nations, particularly when it comes to the NHS contract.
Absolutely. Within the whole of the UK, we're currently operating under 4 separate NHS contracts, with Wales being, I think, one of the most complex ones to try and get your head around.
You're absolutely hit the nail on the head there with that. I mean, I've put the news on this morning, and again, there's another top story flashing across the screen. I'm sure you've seen it as well. Yet another dentist based in South Wales who is saying he fears there will be no NHS dentists left at all within Wales within 2 years. And within the same article, there's another dentist saying how they can no longer afford to work under the NHS. I mean, it's pretty grim viewing and reading here when you open the paper or the TV. I mean, what's your thoughts on it, Lou?
Yes, absolutely. It doesn't make for pleasant reading. And I, in fact, woke up to that article myself this morning, which was sent to me by my son, who's up in Newcastle. So, yes, it's not great reading, particularly for the NHS contract that we currently have in Wales.
Yeah, well, you're out about in the practices and you see a lot of different people with obviously different contracts, and we've got different contract types in Wales as well, you know, with UDA or reform. But what's your take on how things are out there at the moment? What is it that the practice owners and business managers are telling you when you're out visiting?
It's really difficult for practices out there at the moment. There's a combination of different factors that are contributing to it being so difficult for business owners at the moment. One of them is the NHS contract, as you said, and the difficulties and the complexities that they have to manage that contract. The other issues that I'm seeing are, unfortunately, staffing, recruitment, retention issues, and also as well the financial implications that a lot of practices are currently facing.
Yeah, there's a big bag of different factors that all have a bit of a pinch point, isn't there? So let's have a little look at some of these. I mean, obviously you've touched upon the contract. Can I ask you to give our listeners a little bit more insight into the contract in Wales, particularly in terms of reform and how that will look and what makes it so different and indeed very difficult to work with? I'm aware that we've got people who may be listening that aren't familiar with how things operate this side of the bridge.
Yes, absolutely. I'll try and explain it as simply as I can. We've all been familiar with the 2006 contract, which is the UDAs, and that's the contract that obviously England is still adhering to. In Wales, pre-COVID, they took a different approach and started getting practices, which indeed I was involved in when I was still in practice myself, to do a pilot scheme. That pilot scheme was essentially data collection. And what we had to do was a form, which is called the ACORN form. Yeah. That form is an assessment of clinical need. Gets you to ask some difficult questions to patients regarding their weight, their lifestyle, smoking, alcohol, siblings. Do siblings have caries, dental decay? So it's quite a lengthy process. And as I say, I was involved in the pilot scheme of it. COVID, once we reopened, they used it as a reason to get contract reform, the new contract that we would be working with in Wales, up and running. So it was kind of introduced on the back of the pandemic. And basically, instead of the system which we're all aware of, the UDA system, whereas, you know, 1 UDA, 3 UDAs, 12 UDAs, and that's how you get paid, this is was meant to be focusing more on prevention and access for patients in Wales. So instead of seeing so many historic patients every 6 months, if those patients were dentally fit, then they would then be a year recall. The theory behind that was that then it was going to free up space within a dental practice, that you wouldn't be seeing your patients so often. So then from a preventative point of view, you could take on more new patients.
Right.
However, what they've done is they've introduced different metrics. So the practice now gets paid their contract value based on different metrics, and those metrics are weighted with percentages. And if you achieve those metrics, you then get your full contract value. So we're talking about different things, as in UDAs are still a factor, 25%, but also there's a metric now for your historic patients, for your new patients, and for your urgent access patients. There's also a percentage as well for fluoride varnish application. So it's very, very different and very different way of working for dental practices.
Yeah, I mean, that's very complicated, isn't it? It's a lot to keep your eye on and a lot to monitor. I mean, how on earth, as a dental practice, how do you know if you've hit these metrics or not?
Good question. Basically, I have literally walked into practices where they have a tally and a board in the practice manager's office or in the kitchen, and they literally have them labelled historic patients, new patients, access patients, fluoride varnish applied. And as the patients are coming in, they are marking off a daily tally to see if they're hitting these metrics. It's really difficult. It's very difficult for practices to be able to comprehend how many of each of these they need to be seeing and put a number and a figure on that, so that they can break it down to make sure that they are actually achieving these targets that have been set for them. The other issue is that Eden is difficult. It's not up to date, so you can't rely on the figures that you send in through to be accurate because they're not in real time. And quite often, as we were aware last year, dental practices are not getting their year-end reports until much, much later in the year. So that means that you don't know if you've hit the targets, if there's going to be any clawback, and indeed what the mitigating circumstances are. So if a new patient is going to be worth more than an historic patient, for example. So it is really, really difficult for practices to keep an eye on this, and a difficult task.
I mean, it is a minefield, isn't it? And you're right. I remember last year very clearly. I think it was August, I believe. Some practices, they didn't have a clue what they.
Some even September.
Yeah, it was very, very late. And I mean, the impact on being able to pay associates, there has to be a knock-on effect of all this.
There is, absolutely. And that is an issue. And the problem that's leading to is recruitment and retention issues within Wales, because you're starting your new financial year not knowing what the last financial year brought. So from a staffing point of view, from a financial point of view, from a investment point of view, you don't know until you're halfway through that financial year what last year's consequences were. So as a business, and being able to plan and for the future, and what staff pay rises, for example, you can offer, and how you can pay your associates, and indeed are associates going to face any clawback because they haven't achieved these targets. Those are very difficult conversations for practice owners to be having.
Yeah, you're working with one hand tied behind your back, really, aren't you?
It's difficult. It's difficult because you can't forward plan or project or what investment you're going to have for that year, so that you're going to be able to, if you wanted to put a new surgery in, for example, you're not going to be able to rely on your NHS contract to be allowing you that financial stability that you'd be able to have to be able to foreplan anything.
Yeah, I know. It is. It's a lot to consider for the business owners, definitely. Now, recently in Wales, we've just had the news about the uplift of 6% that's been awarded to us. Now, this is something we've managed to get, whereas our colleagues over in England haven't had any uplift awarded. However, I know we've got it, but I believe, well, I'm going to ask you a bit more about the conditions that may need consideration and what they are and what impact that would have. So, Lou, if you could just explain a little bit more about the conditions that sit alongside this 6% uplift, that'd be great.
Yes, of course. Well, the first thing to take into consideration is, although the 6% uplift has been awarded, you and I both know, Kath, that in real terms, dental practices, conservatively, their costs have increased by 10, 12, 15%. So the 6% is a real term pay decrease, and you're not going to be able to, foreplan anything with your practices on that 6% increase. But indeed, we have received it, which is more than the English counterparts have. It does come with conditions, though, and those conditions are causing quite a stir at the moment. The first one is that the antimicrobial audit has to be undertaken again, and this has to be completed by the end of June 2025. The issue with this is that previously there was funding available for practices to complete this audit, but now that is going to be down to the practices to subsidise to be able to comply with the 6% uplift. The other issue that we've got, which is causing a bit of a stir, is all practice held waiting lists are being transferred to a dental access portal. That again is coming into effect from June 2025.
Can you just elaborate on this access portal a little bit more, Lou?
Yes, previously dental practices have been able to hold their own waiting lists, and as we're aware, that's quite often the best way to get new patients into the business, because you can get friends, family of current patients. So it's already a bit of a recommendation, and you can treat people that are local to the area and local to your dental practice. What's going to happen now is that they're asking dental practices that those waiting lists be handed over to a centralised dental portal. Now, that means that they are going to have the centralised waiting list, and they will now allocate you your new patients. So you could be seeing people from far and wide, different areas, different backgrounds, and it's not going to allow you to have any type of control over the new patients that you take on within your business.
Yeah, it's a huge change, isn't it? It really, really is. And there's some additional funding, I believe, payments for people that are using the portal.
Yes, there is. If you're happy to use the portal, then and you do see one of these patients and it's a dental access, then they will pay you £100 and £50 if that patient does not attend that appointment, which on the face of it sounds like easy money, and it's a way of increasing some revenue into the business. But in reality, that's not going to be the case. It's basically a sticking plaster that they're trying to offer dental practices as an extra incentive to move away from the current way of doing things and to pop them onto a centralised waiting list where they have control.
Yeah, I was with a client in Swansea last week, actually, and she was telling me exactly about this dental access portal and all the changes that came in line with the uplift. And basically their response to it was that they thought it was something they wouldn't really be able to utilise or offer to support much, because they simply haven't got the capacity in the practice to get an NHS dentist to see anybody through the emergency access.
That's an issue as well, and it is going to be a condition that they are going to have to provide these emergency access sessions in order, obviously, to retain or to get this funding. So practices are facing a real issue in how do they carve up the book to fit all of this in as well. From a diary planning and zoning point of view, it's a logistical minefield, because now not only do you have to incorporate your historic patients, your new patients, your fluoride varnish clinics, you've also now got to give the health board allocated access sessions that you will be willing to see people.
It's huge, isn't it? And I mean, thinking about this, recruitment is a challenge, we know that. The costs of staffing are a challenge. The wonderful Labour government have brought in major changes that are going to start impacting businesses from April, where we're going to see these additional costs to staffing, which are going to hit you to the tune of £600 approximately per member of staff if you've got between 8 or 9 or more people within your team. I mean, it's a massive amount of money to find. but there's no change to the contract or the income you can receive from the contract in essence.
Yeah, absolutely. This is part of the issue that we are seeing with the recruitment issues that we're getting at the moment in Wales, is that businesses are now going to have to find, in some cases, an additional 20,000 plus to be able to cover the NI contributions that are changing as of April. They're also going to be wanting and needing to give their staff pay increases because the staff are feeling the pinch from the current cost of living crisis. So previously we had recruitment issues with dentists, therapists. Now I'm seeing recruitment issues with dental nurses, receptionists, and practices are ending up sometimes in a bidding war to try and get new staff, especially qualified dental nurses at the moment seem to be an issue. And as a business owner, if you're solely reliant on this NHS contract or largely reliant on this NHS contract, you're just not going to be able to compete within the recruitment market.
No, I mean, we've known for a long time, haven't we, how difficult it is to recruit for an NHS contract within the practice. If you've got a private offering, you've got a bit more to go on, and we do tend to see those vacancies filling a bit quicker. But it is a challenge. It's a huge challenge. And also just thinking about the contracts, we know that the private patients are subsidising the NHS within practices. And additionally, it's the time element, isn't it? I mean, I think it was you that was telling me about one of the clients that you visited and how much time they were spending on NHS to private.
Yes, a practice manager gave me a quote where she said that she spends 70% of her time for 25% of the practice's income in just managing the NHS contract. So that puts it into perspective. For a start, that 25% of the income is coming from this NHS contract. So the practice's other 75% of the income is being achieved through fee per item patients and also via plan patients. So therefore, those are not the patients that are taking up the time. It's the NHS contract that is making demands on a lot of, especially managers' times, because they're trying to achieve these tallies and to see if there is any way that they can achieve this target. So yes, it's especially difficult at the moment for dental practices out there.
It's really tough, Lou, isn't it? And I mean, we were talking about this previously. I think it was 90% of all practices on NHS will be under contract reform as from April. And, if you're a practice going from the old UDA system to contract reform and thinking of all these different metrics, UDA was hard enough. What extra things are they going to have to think about or consider to change their ways of working so that they have a standing chance of hitting and all the metrics that they need to deliver?
Good question. If I was still a practice manager, what I would be looking at is the contract value, breaking that down into the metrics and the percentages, looking at my patient base. You start doing your ACON forms, and obviously you are going to increase your recall timings to create this gap in the book where you're going to be able to see these patients. But you're going to have to diary zone so that you know that for that day, for that hour, for that half an hour, what patients you have that are being awarded to the metrics that you're trying to achieve during that clinic. So it's going to come down to planning, making sure that you know that within your diary you have those set zones available to be able to achieve these targets.
Yeah. Big changes then, Lou. Very big changes.
Very big changes, especially if you're going from a UDA to a contract reform contract, then you will need to have to think about everything differently. You need to think about what treatment you're offering patients, because things like scale and polishing are no longer going to be applicable for you. So what that means is that every patient who comes out as green on your ACON form, they are not going to be eligible for a simple scale and polish. So therefore, you're going to have to factor in those conversations that you're going to be having with patients, that this is no longer an element of treatment that you can provide. So therefore, you're going to be having to charge them privately if they want to have a scale and polish. Equally, with treatments that you're going to be performing on these patients, are you going to be doing a complex treatment on somebody who's red, for example, or are you going to be opting for treatments such as extractions over root canal treatments? Because there's an element then that the patient has to be accountable for their own oral health so that they can be a green patient or at least an amber patient for treatment to be able to proceed. So therefore, it's very difficult. Your mindset has to change. Your recall period all changes. Your patient base changes, because whereas you've been used to seeing Mrs. Jones, who comes to see you and has seen you for the last 20 years, you're now going to have those difficult conversations with her and say, we've done a really good job. You are dentally fit. Therefore, I can now no longer see you every 6 months. I have to defer you now to a 12 to 18 month wait for you to be able to come in and see me for your routine examination. So you're going to have to be prepared to have some difficult conversations with your patients who might not be accepting of these changes that this new contract is going to bring for you as a business.
Yeah, certainly a lot of food for thought there, Lou. It's really interesting, is it, when you start talking through everything and how much it highlights the change from the then to the now. I mean, there's lots of things out there that's having an impact on practices overall. I mean, just going back to the articles and the news on television today with the dentists in South Wales, you know, morally, they don't want to have to make changes. They're very concerned about what's going on out there. And it's almost like a cry for help, isn't it? That they please do something with this contract. It's not sustainable for us anymore. I mean, can you see things changing? Where are you seeing things heading? Are you getting more requests for conversions or move towards private, Lou?
Yes, certainly. I think that it's very difficult for a dental business owner and for dentists in general, because they've gone into this profession to be able to provide people with care. And the fact now that they're having to look at each person with a financial tab as well, in terms of what care that they can offer these patients, but and to be able to run their business as well from that perspective. And a lot of them do have a very moral reason for remaining in the NHS. Yeah. They don't want to treat children and vulnerable adults, or people who can't afford to have treatment. But to answer your question, yes, I am certainly seeing a move. Not so many full conversions, and I think that's for the reasons that we just discussed, in as much as people are keen and eager to keep some NHS contracts so that they can fulfill that obligation, but certainly for partial conversions where practices have looked at the figures, the numbers, and they don't add up. And you've got this deficit that you're trying to fill, this void of this 10, 12, 15% that you're already seeing, plus the extra possibly £20,000 that you're going to have to find. So therefore, yes, I am seeing more partial conversions where practices are handing back part of the NHS contract and then retaining a smaller, much more manageable contract as opposed to what they would have once held.
Yeah, I agree with you. It's definitely the same message that I'm seeing. There's definitely a lot more noise within the last few weeks in terms of, you know, it's that end of year now, isn't it? It's the pressure point. We're right smack bang in the middle of February and everybody's really, really feeling it. We've had the info on the uplift. We've had the realisation that we're not going to achieve contract. We're going to have more clawback next year again. And I think people are really starting to sit and give serious consideration as to what is viable for them moving forward into 25 and 26. Lou, it's lovely to speak to you. I know when we get together, we can't half thrash it out a little bit and go through a lot, but it's always time really well spent. Thank you very much for taking part in today's podcast. I'm sure there's a lot of information there that's been of real interest and value to our listeners.
Oh, croeso Cat, thank you. Diolch yn fawr iawn I ti. And
diolch yn fawr iawn.
My absolute pleasure.
And of course, if there is anybody out there listening to this podcast who would like to have a chat with us or find out a little bit more, please do reach out to Practice Plan, and Louise and I would be really delighted to come and have a chat with you. Thanks very much, everybody. Bye now. Goodbye.